Hello my friends, my name is Dr. Saeed Kazmi. You're watching my YouTube channel, and in today's video we would be talking about how to interpret a pediatric chest X-ray, especially the chest X-ray which has been either reported to be showing non-specific increased bronchovascular markings, or what we call as a dirty chest X-ray, an X-ray which has got a lot many of these non-specific markings all around in the lung fields. So we will start with a very simple clinical case. And that case is that, let's say, a toddler presents to your clinic or to your emergency department with a mild cough and has got a history of intermittent wheezing. Now, for some reason, because this child is not properly responding to the treatment, you do a chest X-ray, and the chest X-ray report shows that this child has got what we call as increased non-specific bronchovascular markings bilaterally. It simply means that the both lung fields are showing a prominence of the bronchi and the blood vessels. Now, many doctors as well as parents, they usually, when they read these types of report, they usually panic. They think, is this pneumonia? Is this infection? Is it some form of lung damage? And if it is lung damage, is it dangerous? Now, a simple answer is that non-specific simply means here that it is not specific to anything. Now, this is the most important word in the report, non-specific. It simply means that the airways are a bit irritated, they are a bit swollen, but it does not actually tell you that it's an infection. It simply tells you it might be an infection, but it simply means that these airways are irritated and they are a bit swollen. Now, for that, we also need to understand that what is a normal baseline. If you look at this chest X-ray, normally, a chest X-ray has got two lung fields which are darker in color, and in the center you've got the cardiac shadow. Cardiac shadow is obviously white, and then you have got the vessels coming out of the heart. We have got the mediastinal shadows, the hyla, so on and so forth. Now, if you see from both hyla, you would see that there are white branching wisps which are spreading from the center in both directions. So if you look here, these are branches, white and blackish sort of things, which are going towards the periphery of the lungs. Now, here in the center, you've got the larger airways, which we call as the main bronchi. And as they stem and branch, into smaller branches, they become small and small as they go towards the periphery. So the larger airways are in the center and the smaller ones are towards the periphery. Now, because X-rays are based on density, now these whiter, these thicker, these fluid-filled structures, because they're filled with blood, and they show against the black air-filled tissue. Now, obviously, the lungs are full of air, so the bronchi, they show up as black markings. Now, the important thing here is that these markings, if you look at these whitish markings, okay, these taper off towards the end of the lung. So if you see, they are more prominent, but as you go towards the periphery of the lung, they become faint and faint and faint, and you would see that they never reach the end of the periphery of the lung. So they would not reach the very end of the lungs. They usually somehow disappear short of the end of these lungs. So what we call is they never reach the outer edges of the ribs. So this is a very crucial finding in a normal chest X-ray, that even if you are seeing these denser, whitish lines going out, they usually stop before the end of the lungs, before they reach the edge of the outer lung fields. Now, important thing is to spot the signs of what we call as increased bronchovascular markings. What do we mean by increased bronchovascular markings? For that, we need to understand the triad of airway inflammation. And the triad of airway inflammation are three things. Number one is what we call as extension. So extension means that these web-like, structure of vessels, they become more and more they are so prominent, they are reaching into the outer area of the lung field. They are reaching to the periphery. So one thing is extension of these white lines into the periphery. Number two is what we call as cuffing or peribronchial cuffing. So if you take a cross section of a bronchi, so let's say if this is a bronchus, and if you cut it in the center, what you will see is that because this contains air, it would be black in the center. But because the lumen of this bronchi is inflamed with, obviously it is thickened, so there would be a white rim around it. So there would be a central blackish thing, like blackish, and then there would be a white ring around it. So we call it as peribronchial cuffing. So peribronchial cuffing simply means that you have taken a cross section of the bronchus. In the center, you see a black mark, and then there is a white rim around it. So black center, white rim, just like a donut sign. Okay, so that is known as peribronchial cuffing. And the third thing of the third part of this triad is what we call as tram tracking. So tram tracking is a simple thing. In peribronchial cuffing, you are basically looking at the bronchus if you take a cross section of it, while if you look it from the side, so again you would see and like a column of air, and then there will be thickened the lining of, so those thicken because they're running parallel to one another, they would appear like as white lines of a tram track. So that's why we call it tram tracking. So in tram tracking, you are actually looking at the inflamed airway from the side. In peribronchial, you are looking at through the cross section. So the three things in airway inflammation, number one is that these white lines would be reaching the periphery of the lung tissue. Number two, you would see peribronchial cuffings around the hila, and you would be seeing tram tracking. So these three things are important hallmarks of airway inflammation. Now, what do we mean? Like, let's dissect into these things a bit more in detail. Now, when the airways become inflamed, obviously they become full of mucus. Because there is inflammation, the walls of the bronchi, it becomes thicker. And when that becomes thicker and becomes more sort of a dense, then obviously it would show up as white lines on the lungs. So what happens? Normally, I told you that if you look at these white lines, they go laterally, they become less and less dense, but they never reach the end of the lung zones. But if there is inflammation for whatever reason, if it's a viral inflammation, bacterial inflammation, environmental inflammation, parasitic inflammation, whatever, then what would happen? These thickening of the lines you could see even at the edges of the lung field. So that is what we call as extension of these thickened lines into the periphery of the lung zone. And that gives you that very busy appearance that the lung fields on the chest X-ray, they look very dirty because these lines are everywhere. They're going towards the periphery of the lungs. That is number one again. Number two, as I told you earlier, that is the peribronchial cuffing. And peribronchial cuffing, I told you that if you take a cross section of an inflamed airway, in the center it's air, followed by this rim of the thickened lining of the airway, which gives a donut sign, which actually, if you see here, you can see here on this X-ray, if you see here, right where the air mark is, you can see here that there's a central red and then there's a white thickened lining around it. So this is actually what we call as donut sign or peribronchial cuffing. Again, in the over here, you can also see, you can see that there is a blackish shadow right in the middle, and then there is a white rim around it. Again, so this has been a cross section of an inflamed airway. So this is peribronchial cuffing. And you will see a lot of peribronchial cuffing around the hila, as well as if you go periphery, if you see more and more of these peribronchial cuffing, because obviously if you go laterally, that should become less and less. But if it is, you can find it in the periphery, it simply means that there is an airway inflammation. So that is what we call as peribronchial cuffing. Coming to the third one, that is the tram track appearance. Okay, so here if you look at this chest X-ray, right here, you can, if I draw a line at this point, so there are two white lines over here. Let me again, right in this yellow circle, you can see two white lines, right where I have drawn this red circle, two white lines, and there is a column of blackishness in the center. So this is basically an inflamed airway, which you are seeing from the side. So in the side, you can see, because now you are looking it from the side. So there is this column of air, which appears black, and there is thickening along this whole length of the bronchi, which would appear as white. So that is known as tram tracking. So increased bronchovascular markings basically would be a triad of three things. You would be seeing more of these lines into the periphery, you would be seeing peribronchial cuffing, and you would be seeing tram tracking. So if these three things are present, it means that there is airway inflammation. And this is what we call as non-specific increased bronchovascular markings. But there's a technical trap here. Increased bronchovascular marking does not translate automatically into an inflammation or inflammation caused by an infection or, let's say, environmental exposure. No, not like that. Sometimes it might be because of a poor inspiratory effort. Now, smaller kids, they do not like when they are being held for chest x-ray. So sometimes they might cry. Now, normally, chest x-rays are taken when a child takes an inspiratory effort. So when the child inspires, the air goes in, the image, the chest x-ray is taken. But sometimes if the child is crying, he may be very unsettled. And what happens that timing gets disturbed and the x-ray might be taken during expiration. So what happened in the expiration, what happens, the air is coming out. When the air is coming out, what happens? The lungs, they deflate. So what happens this when there is less air, what would happen? That these airways, they basically collapse. There would be less blackishness. So what happens? All the normal blood vessels, they would be squished together. So everything becomes more together in expiration when the child is exhaling. So what you would see is that basically these black and whitish shadow, they come very close to one another, and that might give an impression that there are increased bronchovascular markings, non-specific, which you might think is because of let's say, an inflammation caused by a viral V's or anything else. But in fact, it is simply because of poor inspiratory effort or simply because of an expiratory film. Like, look at this, these X-rays. Okay, if I slightly enlarge these ones, you can see here that this first film has been taken in inspiration. So in inspiration, you can see there are white markings, but they do not reach the edges of the lung fields. This is the same child where the X-ray has been taken in expiration. And if you look at, let me decrease the size, and you can see now the right one is looking more dirty because there are more whitish, like these lines going into the periphery. And if I just sort of enlarge it further, maybe you can see a few, like, peribronchial cuffing over here and over here as well, and on this side as well. It is not an inflammation. It is simply because this second X-ray has been taken in an expiratory view. So remember, if the film has been taken in expiratory view, it would give you increased bronchovascular markings. So do not get fooled by this thing. If it is an expiratory film and the child is fine, do not interpret this as airway inflammation because of these increased bronchovascular marking, because this is caused by what? Expiration. Okay, so this is one of the causes of the false positive. Then coming down to if it is really caused by pathological reasons, one of the most common causes of increased non-specific bronchovascular markings are viral infection, respiratory syncytial virus, human metapneumovirus, influenza virus, parainfluenza virus, coronavirus, rhinovirus. There are 200 different types of viruses which can give viral inflammation of the airways, and that can cause non-specific increased bronchovascular markings. Many children less than 5 years of age, they have got reactive airway disease, they suffer from viral V's, or some of them might be asthmatic as well. And when they get this repeated airway inflammation and mucus plugging, they get these increased bronchovascular markings. And the third thing is those kids who are exposed to environmental things like, for example, heavy smoke, secondhand smoke, or environmental allergens, they might develop inflammation over a period of time, causing thickening of the airways, causing these increased non-specific bronchovascular markings if a chest X-ray is done. So these are some of the few pathological causes that can give you increased bronchovascular markings on the lung field. So the ultimate takeaway is that you always diagnose non-specific bronchovascular markings if you see it on a chest X-ray in the context of the clinical findings. Because if a child has got mild V's or something, it might be telling you that the airways are inflamed, but it does not specifically tell you that there is an active infection or there's a pneumonia, because pneumonia is diagnosed on other things. So keep these things in mind, that this is a very common chest X-ray representation, increased bronchovascular markings. Remember, how do you know? Number one is that there is extension of these whitish lines to the periphery. Number two, there will be peribronchial cuffing. And number three, there will be tram track king of the airways. Remember, the context matters. If it is an expiratory film, that might be the reason of increased bronchovascular markings, or it might be because of the reasons, pathological reasons that I just discussed right now. So I hope you have learned how do you interpret increased bronchovascular markings on a pediatric chest X-ray. If you've got any question, put it down in the comment section below. I will be more than happy to answer that. Have a very good day. Take care and bye-bye.